Hi, my name is Kent Johnson. I work for LA Sports Performance Care, and this is my model, LA Man, and we're going to demonstrate crossover tricep kickbacks. And crossover tricep kickbacks are used for a number of reasons. Most athletes or patients, when they're taught to go ahead and train their triceps as a rehabilitative exercise, uses the rope or skull crushers, or they do just tricep press downs. And what's forgotten is that the tricep is not only an elbow extensor, it's also a shoulder extensor. So it's really good to go ahead and do it this way, and it's perfect for actually rehabilitating athletes who have participated in an imbalanced exercise program that has loaded up the anterior delts, has loaded up the bicep tendons, and they actually are suffering from bicep tendinitis or some sort of impingement syndrome to the infraspinatus or supraspinatus. So as you can see, Ali actually has the cables actually crossed over, and she's rolling her shoulders back, and as a pan around, she's squeezing her shoulder blades together and depressing them. Okay, and she's going to hold that position the entire time. She's not going to allow that to go ahead and relax. So she's using her middle and lower trapezius to actually pull the shoulder blades together and down. And she's going to roll the shoulders back as hard as she can. And now if you look at her arms, her humerus, it's not going to go forward or back. Only her elbow is going to move. Now she's going to go ahead and start doing her repetitions. And as you see, as she does that, she rolls her shoulders out, and she actually externally rotates her shoulders. And what that does is it actually opens up the front of the shoulder and closes down the back of the shoulder. So while we're training triceps, we're also actually working on the rear delt, we're working on infraspinatus and supraspinatus, we're opening up the front of her chest there, so we're actually turning off her pec minor and major, her latissimus dorsi, the biceps in addition to all of that. So it's a very controlled motion. And what you're going to notice as soon as you do this exercise, that you're not going to be able to do a whole lot of weight in the beginning. And that is not the purpose. The purpose, again, is to go ahead and actually open up the front of the shoulder and close down the back of the shoulder. And you're doing this by strengthening the rear delts, middle and lower trapezius, infraspinatus, supraspinatus, and the triceps. And this can be done daily. If you have any problems as far as pain in the front and whatnot, then you need to go ahead and cease, and someone needs to clear out the front of your shoulder.